Welcome to Ask the Doctor Live here at Emanate Health. My name is Sergio Hernandez. I am the medical director of the emergency department here at Emanate Health for all three hospitals within our system, Queen of the Valley, Intercommunity, and Foothill Presbyterian. Welcome for my talk here today is on COVID-19 as it is today, and hopefully I'll take you through a journey of where we were to where we are today. So this is COVID-19 as it relates to emergency care in the emergency departments here in your local area. So this is our mission statement here at Emanate Health. We want to keep you well, but not only in body, but also in mind and spirit. We want to provide a place that's compassionate for both you and your family, as well as safe. So we want to make sure that we are taking care of you as a person, as well as your family members, to make sure you get back home healthier and safer. This is our health system. As you can see, it's a combination of three major hospitals as well as a hospice center. You can see some of the details there just to provide some background in terms of our system and the areas that we serve. But it goes beyond the hospital. We also have a ton of clinics, imaging centers that really treat, like what we mentioned earlier, the total person. So we have a lot of specialty clinics out there. You can review the map and reach out to us if you have any questions or want to make any appointments. So let's start. This talk, like I said, is to discuss the pandemic that we're living in currently and where we've been and where we're going. And hopefully with this talk, we'll discuss some of the treatment options that you can get in our emergency department, as well as things to look out for when you're at home, deciding if you need to seek emergency care or speak to a physician. So the world changed, changed a lot, and all because of this little virus that you see here on screen. We didn't know what to expect, and it really started kind of in these areas. We talk about Wuhan, and looking back at it from a medical director's point of view, it was scary, just like it was for all of you probably. We had a virus that nobody knew anything about. We thought it was contained in China, and borders were starting to close. And then we noticed its migration into Italy and into New York. And we can all remember the images on the news of the impact that it had on New York and in Italy. And we started seeing how this was exceeding critical care space. A lot of people were dying, and really all the countries around the world, all the health systems around the world were in panic mode of how we contain this virus and how we can understand it. And it was because of all of these things. We really didn't know anything about the virus. One, we didn't know how it was transmitted between people. We didn't know if it could be spread via blood, aerosolized by droplets. We really didn't know. We didn't know who could be immune. Does anybody have baseline immunity? What happens if you're exposed to the virus and you get sick? Are you immune then? Even disease progression. We started seeing that some people really didn't get sick. Some people got the sniffles, other people lost some smell and taste, and unfortunately a lot of people did die. And we didn't know why it selected some people over others. And which comes to my next point. We started discovering a lot of symptoms associated with this virus, and we still are. In the beginning, we thought it was just kind of common flu-like symptoms, and then things started coming around like the loss of taste, the loss of smell, some of the rashes that are associated with the virus, some of the long-term effects. And because we didn't know how the virus really impacted our bodies and which patients to be cautious about or not, we really didn't have any good treatment options, which I think led us to the positions that New York and Italy were faced. And so as a medical director, it's kind of figuring out how we respond to this and make sure that you, our patients, are safe, as well as our staff. We have to make sure that everybody in the hospital is safe. So how did Emanate Health respond? And like this, I know it's hard because this employee is wearing a mask, but just given her expressions, you can see that she has a smile. And I think that's an important part where I have become appreciative of Emanate Health, is really the focus on employees, staff, to make sure that we are safe. Because during this pandemic, there was a huge amount of stress of, am I going to bring this virus home to my family? Am I going to get people sick? And on top of that, of dealing with a huge amount of critical patients, you can imagine the stress level was insanely high. So working here, as you could see, this employee, I felt safe coming to work. I felt that everything was there for me so I can treat all my patients safely. But we had to treat you safely too. And if you've driven by any of our hospitals, what you've probably seen are these structures here, which are tents. And this was part of the first wave. So, like I said, all the hospitals in our system were scared. We didn't know what to expect. And so in doing that, we prepared using these tents because we knew that we had to separate people who didn't have the virus from people who did have the virus. And how do we do that? ERs weren't made for this kind of separation in large scale. They were made to treat everybody and bring them in. And so very quickly, Emanate Health deployed these tents, where you've probably seen at many other hospitals, that they were air conditioned, they had appropriate isolation mechanisms to keep people safe. We moved some nursing, some advanced providers into this tent to treat patients. And so that was our initial first barrier into getting in the hospital and really getting people exposed. You could see here the inside of the tent. You could see here that it's air conditioned. It had all the appropriate protective equipment needed to really treat all of our patients and to keep our staff safe. And so what happened? Everybody was talking about this big first wave, the disaster of New York, what was going to happen in the rest of the country. And so we really staffed up. We brought in a bunch of extra nurses. We made sure that areas were created to keep people separated. Inside of our emergency departments, we made sure that our rooms were as isolated as possible if we did have anybody who had the virus. But you have to understand that there was a huge amount of fear. Why? Because we didn't know who had the virus. Testing was extremely limited. Testing could take days to weeks to get results back. And so when you had patients come in, you sometimes had to assume that they had COVID-19 and protect them, but really not know. So there was a big fear factor on how we treat these patients, how we isolate them, to make sure that other patients are safe. Because at that point, we didn't have this widespread in LA County. And there were a lot of treatments. I know a lot of you have heard about, hydrochloroquine, and there was controversy around that and figuring out what is going to work against this virus. But in the end, it was interesting, as you've all heard, that New York really didn't come. Here in Los Angeles, we did see a small spike, but not to the point where they saw New York, which led us to kind of adjust our staffing and try to figure out what's the best way to approach this as we're getting new data on how to treat this virus. But then came the second wave, and I would say this came around November, December, around the holidays, and this is when people were starting to get together. People were, I think, a little bit homebound and wanted to see significant others and families like we all do. And this led to a second wave that really impacted our hospitals. There was a point in time where Los Angeles County was the epicenter of COVID-19 in the country and maybe even the world. Los Angeles County for a long time didn't have any ICU beds available for patients, and most of the hospitals were full. And this is really what we fear. This is what we had been prepping for last March, is this moment. Luckily, we had done a lot of prepping here at Emanate Health to ensure that we had the protective equipment needed. But this surprised everybody in terms of the impact that we felt in Los Angeles County. Equipment was in short supply because a lot of people were sick. You heard that we didn't have enough ventilators for intubated patients, and that was real. we were trying to figure out what medications worked for a lot of these sick people, and things became clearer, and so we were able to treat a lot more people effectively. But unfortunately, this virus does impact some more than others and for longer periods of time. So we did have a lot of sick people in the hospital that required long stays in the ICU, which limited the amount of beds we actually had at the 3 campuses. But there was always a light at the end of the tunnel. We kept hearing about vaccines. Were vaccines going to come to the rescue? How quickly they were going to become? And still anticipating more and more medications to be able to treat these patients effectively. So a very scary time. We did feel more prepared, but I don't think any of us were really ready for how much it impacted Los Angeles County. And so we had to go kind of even outside the box. If you came to Queen of the Valley, then this is an example of a tent in front of the emergency department. We needed a place to keep patients outside of the tent even, to make sure that we can rapidly see them and test them. Because at this time, at the second wave, we did have rapid testing available. So we were able to better distribute patients depending if they had COVID-19 or not. And so we had to create different workflows, and this happened at all of the other hospitals. So what can you do now? There's a lot of information out there on social media, on websites, CDC, different avenues that we're hearing. But what can you do, and what are the things that can keep you safe if you get COVID-19? So what are the symptoms that we care about? So a lot of patients come to the ER and they ask me, okay, doc, like I have COVID-19. What do I do? And the important thing to know is we really only admit people to the hospital if they're hypoxic, meaning that their oxygen level is very low. That can be a contributing factor with other issues, like if you have heart disease, diabetes, if you have chronic lung issues. But for the most part, we're looking at if your oxygen level is low. If it's not, then really what we ask you to look for is shortness of breath, because that is the main symptom we're looking for to bring you into the hospital. Now, if you've watched other Facebook Lives, there are some other symptoms that go along with COVID-19, like some of the neurologic findings. There are increased rates of stroke, increased rates of blood clots. So if you're having any stroke-like symptoms, any chest pain, anything like that, you should always come into the emergency department or call 911 as soon as possible. But the main symptom that we look for is shortness of breath. And how do you monitor that? That's with a pulse oximeter. You can see it here on the screen. I always ask my patients to buy a pulse oximeter on Amazon or at your local CVS or Walmart. This is a great tool. They're not always 100% accurate, but this is a way that you yourself can monitor your oxygen level at home. And so they're pretty simple. You put them on your finger and it'll give you a reading. The best you can get is 100%. And what we look for is for you to be as close to 100% as possible. If you start falling below, I would say 94% on a regular basis, you should come in to be evaluated. Right now, things change, but we are looking at oximeter ratings of 92% or less to be admitted to the hospital, unless you have other severe diseases like diabetes and lung disease, like I had mentioned. So if you are diagnosed with COVID-19, I think this is a great monitoring tool that you can use at home. And let's talk about treatments. So we've heard about Tylenol and ibuprofen. Currently, the thought is that you want to use Tylenol for any body aches, any fevers that you're having. You can still use NSAIDs like ibuprofen or Motrin, but there is some research to suggest that it may inhibit your response to the virus. So if you can get away with just Tylenol, that's what you want to use to control your body aches and your fever. Vitamin D, there is some evidence to show that vitamin D is protective when you have COVID-19 infections. And these are the doses you want to use. It's 600 international units if you're less than 70 per day, and 800 international units if you're over 70 per day. People sometimes when they come into the ER, they say, well, I have COVID-19. Can I get antibiotics? And unfortunately, antibiotics are not recommended. The reason is COVID-19 is a virus, and antibiotics work against bacteria. And so if you do not have a bacterial infection, unfortunately, antibiotics will not work. So don't expect to get antibiotics if you purely have a viral infection. How about steroids? So there's been a lot of news about steroids. The data really suggests that steroids should only be given in people who are sicker on the spectrum. So if you're hospitalized, if you need oxygen, those patients really benefit from steroids. But steroids really shouldn't be given on a routine basis for COVID-19 infections. So that may be something that you may ask but not receive when you come into the emergency department. Other supplements early on really got a lot of headwind. If these could be helpful in COVID-19, one of these is zinc. And unfortunately, the data hasn't really shown that zinc is effective in helping the body fight COVID-19. So that may be something that you need to be aware of. The next is monoclonal antibodies. This is something that you can come into the emergency department and potentially receive. So you can see it there. It's an injection. I'm going to try to pronounce it. It's bamlivibab. It's a tough name. There are a couple other medications out there that are monoclonal antibodies. And how this works, it's really in this bottle, there are antibodies that will actually bind the virus and eliminate it from your system, which sounds amazing. And it has shown to improve patients once they get COVID-19, so they don't have to come back to the hospital. The question that people have is, who can't get it? We'll talk about who can't get it before who can get it, because that's important, who can't get it. So if you need oxygen, or if you are hospitalized, you should not get this therapy. It's actually shown to make things worse. So both of those type of patients would not be offered this antibody. But certain people can get it, and these are the people who can get it. So your body mass index, you can use a calculator if you don't know it offhand. You can go to Google and just type in what is my BMI. They'll take you to a calculator. But if you're 35, BMI of 35 or more, if you have chronic kidney disease, diabetes, if you're immunosuppressed, if you're older than 65, or if you're older than 55 with some other comorbidities, if you have any of these and you have COVID-19, you can come into our emergency departments, Queen, Intercommunity, or Foothill, and would be offered this immunotherapy. The faster you can get this therapy in your disease course, the better. You don't want to wait for 5 or 7 days into your course. If you're diagnosed day 1 or 2, that's the best time to get it. It takes about an hour to get infused. People tolerate it really well. And like I mentioned earlier, people do well on it, and a lot of times don't have to come back to the hospital, and it reduces ER visits and potentially hospitalizations. Then we go into kind of worst case scenario if you get sick enough where you need to come into the hospital. And like I said, your oxygen level went really low, or you had some other type of symptoms like stroke or blood clot or heart attack. What are the treatments that you would expect to get? So the first is oxygen. Now there's different levels of oxygen that we can administer here at the hospital. One is just a basic nasal cannula, a mask. We can do the mask with the bag, and that gives a lot of oxygen. There's a relatively new technology where it's called high flow nasal cannula. We can put a nasal cannula on you and administer 40 liters of oxygen, which is a lot, which we've been using during COVID. And we can advance that if it's really difficult for anybody to breathe. Obviously, we can intubate you to oxygenate, provide oxygen to you. This is where I talked about the steroids. This is the steroid that we have been using in patients who are really sick. Dexamethasone, you should expect to get some steroid treatments. This is remdesivir. This is on the picture that you can see there on the slide. Remdesivir is a medication that we use for hospitalized patients. It has been shown to improve patients in terms of their morbidity or mortality. So this is a mainstay of what we treat patients with. Blood thinners. It has been shown with COVID-19 that it does cause hypercoagulability, which means that your blood kind of starts to clot and can create complications associated with that. I'm sure some of you have heard about COVID toes. Those are those clots that you'll get on your toes or on your fingertips, on your skin, that you can kind of see darkening there. which is a sign of clotting. Strokes and heart attacks and blood clots can all be secondary to COVID-19 infections. And so when you come into the hospital, you're more than likely to be started on a blood thinner to prevent those. And then convalescent plasma. What is this? This is from patients who have had the COVID-19 virus, they have been infected, and they made it. And their body has created antibodies naturally to this virus. And so they will donate their plasma. Obviously, it'll be screened for all of the other diseases like HIV and hepatitis. And then it will be infused in these patients in the hopes that the other patients' antibodies will help fight the current COVID-19 infection in this patient. So these are some of the things that you can expect if you're hospitalized. Now let's talk about prevention. Prevention is still the main focus to help curb COVID-19 and get it under control. And the first one obviously is vaccinations. You've heard about the three main vaccine types that we have here in this country, which is Pfizer, Moderna, and Johnson & Johnson, which actually just got approved and just started getting injected a few days ago. So I do feel like vaccination is what's really going to change the course of this disease. And we can talk about that in the future if all of you have any questions. Social distancing. I know myself really long to be with my family and friends. I myself am vaccinated, luckily, as a healthcare worker. But even then, we still have a focus on social distancing because that is that as well as protective equipment like masking, wearing face shields are really the mainstay until we can reach some herd immunity with this vaccination rate. So it's really important, like I mentioned earlier, we're still learning a lot about COVID-19. If you come into the emergency department, I cannot tell you all the symptoms you may have, or even if you are going to get sick or requiring hospitalization, or you're going to do fine. It's really difficult right now to know. So I always ask patients that if you don't feel right, if you feel uncomfortable, if you feel something is wrong, don't delay your care. Come into the emergency department, your local emergency department, call 911 to make sure that you are safe, especially during this time. That concludes my Ask the Doctor. I'm happy to take any questions. Hopefully this was valuable to all of you. I am going to be actually looking at my phone, so I apologize for that. I'm getting questions sent to my phone, so I'll start reading off some questions here, and I'll answer as long as they keep coming. So the first question we have, are you able to order home oxygen for COVID patients that need it without having to be admitted? So great question. So there are patients who need oxygen, but nothing else. They don't need any steroids. They don't need any medications. All they need is oxygen. So when we had that second wave, it was pretty scary because all the manufacturers of oxygen tanks were kind of sold out. We really couldn't find them for patients to go home. Now things are starting to stabilize. So if you came into the emergency department and we decided that you needed oxygen but didn't really need anything else, then what we could do is we can work with case managers, with your insurance plans, to see if we can get you oxygen at home. It still needs to be validated or authorized through your insurance account, but that is something that is an option that we can work on. Next question. What are the wait times for non-emergent care at the ER? So ERs are crazy. If you've ever been to an ER, and hopefully you haven't, we can get anything in the ER. You know, sometimes we can get something as simple as, you know, I bumped my head, I'm just worried. Something someone who cut their finger, who wants it repaired, to something like a heart attack. And we really can't judge when that next critical patient is going to come in. And I know it's frustrating because I've been a patient as well, to see people jump ahead of me or waiting for a long time. Just know that here at Emanate Health, my focus is to really treat patients as quickly as possible. Our goal is to always treat patients in less than 30 minutes so that you see a physician or an advanced provider within that time. That is my goal because I want to make sure that everybody is evaluated and everybody is safe. So that's what you should expect. Now, granted, things may change and there may be a lot of critical patients, which may slow things down. So I apologize, but that is what I always strive for. Next question. How do I monitor my oxygen at home if I have COVID? We mentioned that, the portable pulse oximeter. If you can't afford one, if you can't find one, just monitor your symptoms. So people with COVID a lot of times will describe shortness of breath at rest. Or I'm sorry, shortness of breath when they walk, when they move around a lot, when they're doing activities. When you start noticing that your shortness of breath is getting worse, and so sometimes what helps is a journal. If you just document to say, I was able to walk 2 blocks without getting short of breath, then you can document that. And then the next day you might say, I was only able to walk a block. Or the following day you say, now I'm kind of short of breath at rest. When you bring that information to me as a physician, now I can kind of dictate where you're going in terms of your course of disease and make some better judgments on how to treat you. So that might be a way, if you cannot afford a pulse oximeter, to make sure that you're keeping track of how you're feeling and not forget. Next question. If I had a hernia and it was fixed with a large mesh when I was heavier, I have since lost weight, what will happen? So not being a surgeon, I can answer this question by saying the mesh is meant to integrate into your body. It's meant to be absorbed, held, and a lot of times either those meshes will be absorbed into the tissue, so it'll stay there permanently. Sometimes they are absorbable, but most of the time they're meant there to just stay. So if you have lost weight, as long as you're not having any discomfort, as long as there's no evidence of mesh failure, meaning that you're seeing that hernia pop out again, then you're fine. Nothing to worry about. They wouldn't take it out. Next question. Does a healthy diet play a role in helping get better if I have COVID-19? We're still learning a lot about this disease, but I myself am a big proponent of healthy eating. Food is our medicine, and I think that more and more medicine is starting to transition into that. We need to get away from medications always fixing things and really focus on what we're putting into our bodies to make sure that we as individuals are healthy. And so I do believe that if you have a healthy diet and if you come into it healthy, you'll have better chances against COVID-19. Now, we do know that there are some genetic factors that play a role into how sick people get with COVID-19, but I really think if you start off healthier, you have a better chance to fight it off. A great question. Next, is the hospital allowing visitors? So the hospital has really been taking its direction from the LA County Department of Public Health. We go by their standards. Recently, there has been a change where they're allowing visitors to come. And currently, the hospital is allowing visitation for 1 hour at a time. And so you can always come into the front desk, they'll sign, they'll give you a time, and you can go see your loved ones. If, God forbid, you have a family member who is critically ill and close to death, we are making things available so that families can come in and be with them for longer periods of time, because we understand that families want to be with their loved ones. But this is ever changing. I think coming up very soon, we will allow visitors in the emergency department to make sure that you can be there. I know the emergency department can be scary and there's a lot of unknowns. And speaking as a physician, it's hard to make decisions without input from family and friends. So we are looking to bring patients back into the ER with their families, and that will help us deliver better care. But for now, we're going along with LA County Department of Health guidelines. Next question. Can COVID vaccine change your DNA? I hear people not wanting to get the shot because of this. So great question. I know that this is something that a lot of people have feared. We'll speak first about the mRNA vaccines. So this is your Pfizer and your Moderna vaccines. The Pfizer and Moderna vaccines, or these mRNA vaccines, are really a true scientific miracle. This is something that people have known for a long time. It's a lot faster, and the way that and I won't bother people with the scientific details in regards to mRNA versus DNA, but with mRNA, it cannot be converted into DNA and integrated into your DNA sequence. Really what it's meant to do is signal your body to make these antibodies to really fight off the virus. And then so it's just allowing that mechanism to happen. With viruses in the past, when we've used vaccines, we've actually used DNA for a long time, either with dead viruses or modified viruses, to insert DNA in so that then your body recognizes that DNA and attacks it. So the reason that Moderna and Pfizer's vaccines were so unstable and required that big refrigeration times or those really severe temperature requirements was because they were mRNA, which is not as stable. The new Johnson & Johnson vaccine, the one-time dose, is much more stable because it's actually DNA, and it's a modified virus to be able to go in and start this immune response. So none of these viruses will change your DNA. It just speaks to the human spirit and true human ingenuity that has sparked these vaccines to really save us. If we would have waited for an old DNA type virus vaccine, it would have taken much longer, kind of like the Johnson & Johnson one. Great question. Is the hospital vaccinating admitted patients? So, no, not yet. The CDC does not recommend vaccinating active COVID-19 patients. Not in that they would have an adverse reaction, but potentially how they can interact with other people and feel like they may potentially be safe, but actually be spreading the disease. So it is still recommended to have COVID-19 finish its course and then to get vaccinated after that. What do you recommend for long haulers who still have effects after getting COVID-19? I think this is kind of that great mystery, and unfortunately I don't have great answers for that, is why are some people affected with these long-term symptoms? I have patients who have been affected with COVID-19, shortness of breath, or neurologic changes for weeks to months, and it's extremely frustrating. We are going to learn more about this virus, so hopefully in the coming weeks to months we'll have more information for that. I think we have one more question. If a person had COVID and recovered from it, is fine, and tested positive for antibodies, should they get the vaccine now or should they wait? So this is a very interesting question, and I think early on we felt that patients who got infected weren't really at risk, right? And then we realized that maybe that immuno period was 6 months. Well, now we start talking about all of these new forms of COVID-19, and in particular the Brazilian variant, which has already been discovered in about 5-7 states in the US. That has shown to be able to reinfect people who have already been infected with COVID-19, and there's still a lot more being learned. But if you have been infected, if you do have antibodies, my suggestion is still to get vaccinated, because there are these vaccines that have been shown effective against other variants of the COVID-19 virus. So yes, please get vaccinated. People ask, which vaccine should I choose? It doesn't matter. Whichever one you can get a hold of is the best one. The new Johnson & Johnson vaccine, if you don't know, does really, really great at preventing severe disease, really, really great at preventing death and hospitalization, not so great at preventing mild and moderate disease. It's about 85% effective there. But otherwise, if you can get a hold of it, definitely take it. One more question here. What is the deadliest version of the virus? Great question. So they're still trying to figure out which one's the deadliest. The concern is which one is the most infectious or contagious. So the one that we got here in LA County was probably an LA County variant or California variant. versus the United Kingdom variant. And so anytime you have more disease, you have risk of more death. And so there's concern with this Brazilian and South African variants because they are infectious and potentially more deadly because there are some variants that aren't effective or aren't affected by the immunomodulators like that one I talked to you about, the monoclonal antibody, like the South African variant. The Brazilian variant looks like it can reinfect you quickly if you've been infected prior. So what we need to do is just make sure that we continue isolation, continue masking, so that if those variants do come into LA County, we are still safe because there's still a lot that we're learning. That might be it. I think I might be getting one more question. Here we go. If you have both doses of the vaccine, how long do you wait before seeing family? In other words, how long does the virus stay in the nasal cavity? Okay, so I was happy. Let me be honest. I got the vaccine, and I told my family, let's go travel. Because I was excited. I've been homebound. I took the first vaccine, which is a two shot. And so really you have to wait about a week to get the appropriate immune response to really get vaccinated. If you're taking the 2-shot one, you're not fully vaccinated after the first one. You maybe have a 50% immunity rate. Until the second one, then you're at that 95% rate. But you've heard stories on the news saying, I got sick the next day, what happened? Because you need to wait a week, sometimes even 10 to 14 days for your body to get that full immunity. So I would say after the vaccine, you at least want to wait 1, preferably 2 weeks before you're starting to talk to family. And I think coming up pretty soon, if they haven't already, the CDC is probably going to lax their rules on getting together with family as long as people are vaccinated together. So if you're fortunate enough to live in a household where everybody is vaccinated, I would wait a week or 2 and then you're fine. If you're having people still coming in and out, that's outside of your pod of non-vaccinated people, then you still want to be cautious. Let's see. We've got more questions coming. When should we worry about side effects? How long do they last? What side effects are you seeing? I'm not sure in terms of COVID-19 side effects or the vaccine side effects, but I'll go with vaccine side effects. The most common is pain at the injection site. I got the shot. It felt more like a tetanus shot to me. It was sore around my shoulder, but I had minimal side effects. People do describe other side effects, very common to what the actual virus gives you, like fevers, body aches, fatigue, headaches. Those are the most common symptom. And usually the symptoms will last 24 hours. I've heard 48 hours, but usually not longer than that. Next question. Any possible long-term issues with the vaccine? So I guess to kind of put this to rest, the nice part about the Johnson & Johnson vaccine, that's the new one, the one with just 1 shot. That one has no preservatives. There's no aluminum. There's none of these preservatives that some people are hesitant about. So if you have those concerns, I think Johnson & Johnson is probably the best for you. But the other ones have had a fantastic tolerability profile. I mean, there have been very, very few major side effects on Mrna or Pfizer's vaccines, and they're actively taking in those side effects so they can learn more about the effects of the vaccines. So these vaccines just came out. We don't have great data in terms of how, are there any long-term side effects? But if we treat it like other vaccines, there are very little, and those would just revolve around kind of the severe side effects of the viruses or of the vaccines that people have described. But for the most part, like any vaccine, it's tolerated very well, and we don't have any side effects long term. I think that's it. So that concludes my session of Ask the Doctor. Thank you so much. This was a wonderful experience for me. Hopefully you all will be safe. Please stay safe. Call us if you need us. And hopefully I don't see you in the ER, but if I do, we'll do the best to take care of you. Thank you.